What are signs of wrist injury related to bowling? When it comes to bowling and cricket, understanding the signs of wrist injury is essential for any player. Let's take a closer look at what you should watch for. First, pain is often the most immediate sign. This can range from a sharp sensation to a dull ache, especially when you move your wrist or bowl. If you notice swelling, that could indicate inflammation in the wrist area. Swelling often occurs due to injury to tendons, ligaments, or even bones. Another sign to be aware of is tenderness. If your wrist feels sensitive to touch, particularly over the tendons or joints, that could be a warning signal. Reduced range of motion is also a key indicator. If you find it difficult to bend or rotate your wrist normally, that may suggest an injury. Weakness in your wrist can manifest as a feeling of reduced strength or difficulty gripping the ball properly. Numbness or tingling sensations can occur if swelling puts pressure on the nerves around your wrist. You might also experience crepitus, which is a popping or cracking sound when you move your wrist. This can indicate irritation or damage to the tendons. Now let's talk about specific types of wrist injuries that bowlers might face. Wrist tendonitis is one common issue. This inflammation is often caused by repetitive stress during bowling. Signs include pain, redness, swelling, and sometimes numbness due to nerve irritation. Muscle fatigue and soreness around the wrist are also common. Wrist sprains or strains involve stretching or tearing of ligaments or muscles. Symptoms include pain, swelling, limited motion, and tenderness. Wrist fractures, while less common, can occur from direct impact or repetitive stress. Signs of a fracture include severe pain, significant swelling, and difficulty moving the wrist. The wrist position during bowling plays a vital role in preventing injuries. Incorrect alignment or excessive wrist action can increase strain on the tendons and ligaments. Using a heavier ball or an improper grip can also raise the risk of injury. Repetitive bowling without adequate rest can exacerbate wrist issues. For cricket bowlers, it is important to monitor for early signs like mild pain or stiffness. Addressing these symptoms promptly can help prevent further damage. Maintaining proper wrist position and technique during bowling is essential to minimize stress. Using an appropriate ball weight and grip can also help reduce strain on your wrist. Incorporating wrist strengthening and flexibility exercises into your training routine can be beneficial. Allowing adequate recovery time between bowling sessions is key to preventing overuse injuries. By being aware of these signs and taking proactive steps, you can protect your wrist and maintain your performance on the field.